patient will be laying with their knees flexed to 30 degrees but with relaxed hamstrings. Firmly grab the femur with one hand and the proximal tibia with the other. The examiner's distal hand will firmly pull at the tibia while stabilizing the femur. The examiner is looking for the amount of anterior displacement to see if there are any damages to the anterior cruciate ligament.
Make sure the patient is lying supine with a relaxed hamstring. Place the thumb of one hand on the anterior side of the tibia and the fingers grasping the posterior side of the tibia near the joint line. Apply quick posterior to anterior forces through the tibia. There should be a firm end feel. A positive test is excessive movement or lack of a firm end feel.
The patient will be laying supine with their legs together, flexed to 90 degrees. You would then lift the patient's knees and hips to 90 degrees position, parallel to the table. The examiner will then observe the level of the tibial tuberosities.
The subject lies supine on the table with both the hip and the knee of the involved side to 90 degrees. The examiner passively stabilizes the positioning of the subject's hip and knee while assessing the locations of the tibia along the longitudinal axis. A positive finding is a tibia resting more inferiorly than the contralateral side, indicating a posterior sag or instability.
With the patient laying supine with their hip and knee flexed, rotate the tibia medially with one hand supporting the lower leg by holding the bottom of the foot, while the other hand's thumb and index finger are positioned in the intromedial and intralateral joint line on either side of the patellar tendon. With hands in position, bring the knee to a fully flexed position, then bring the hip and knee into a fully extension, and then back into full flexion.
The examiner stands with the distal hand grasping the subject's heel medially and the proximal hand on the subject's knee with the fingers palpating in the medial and lateral joint lines. With the full knee flexed, externally rotate the tibia, introduce a valgus force and extend the knee. Repeat with the tibia internally rotated and a varus force applied to the knee. A positive finding is a click along the medial joint line that is indicating a medial meniscus tear, and a click along the lateral joint line is a lateral meniscus tear. The purpose of this test is to detect gluteus medius tendon tears or weakness in hip adductors. Having the patient stand on one leg, there will be two types of positive tests. A compensated test occurs when the patient's trunk leans ipsilaterally to the side of the stance leg. An uncompensated test occurs when the examiner observes contralateral pelvic drop. A normal test result is when the patient is able to maintain a level pelvis without either of these substitutions. It should be noted that a hip hike is not a true test.